The member for Bass.
Thank you, Mr Speaker. My question is also for the Minister for Health. Mental health and suicide prevention is one of the main issues that's raised with me by parents and young people. Can the Minister outline what actions the government is taking to provide support and security to those at risk of suicide?
The Minister for Health.
Thank you very much, Mr Speaker. And I want to thank the member for Bass, who was courageous and upfront in her first speech about the challenges which she, like so many in this chamber and every other room in Australia, have faced during the course of her and our lives. Whether it's individually or whether it's within our families, our friendship groups, our community groups or our workplaces, we know that mental health is a challenge that will affect 4 million Australians in any one year, that suicide will sadly take over 3,100 Australians on the last year of full figures which are available to the Australian government. And so this is something of profound importance, and we're taking steps locally, nationally and long-term. In terms of the local, during the course of the election campaign, with the advocacy of both the members for Bass and for Braddon, we were able to announce an adult mental health centre for northern Tasmania that will be located in Launceston in the member for Bass's own electorate. And this is something which has been a personal passion and a personal advocacy campaign, and to have achieved so much so quickly is a real measure of the integrity of spirit that you bring to the place. At the national level, one of the critical things in dealing with suicide is recovery and rehabilitation after somebody leaves hospital. We know that the chances of somebody again attempting and completing suicide after they have been discharged from hospital, having been admitted for suicidality, for attempted suicide, is the highest in the country of all of the different ways of cutting the figures. And so that means, whilst this is terrible, we have one particular opportunity here, and that is we know the very individuals who are most at risk. And I want to commend and thank former Prime Minister Julia Gillard for her comments today and her work with Beyond Blue. We are working with Beyond Blue on their Way Back program. So we started with the leadership of Jeff Kennett. The baton was passed to Julia Gillard, and she's been magnificent. And we are supporting the Way Back program with a $37 million government initiative which will track the individuals, firstly in 25 groups, but we want to work with the states to spread it across every single patient who is ultimately discharged from hospital having faced the task of recovery from attempted suicide or suicidality. And then the Prime Minister himself personally appointed and announced only recently the wonderful Christine Morgan, formerly of the Butterfly Foundation but now of the National Mental Health Commission, as his personal envoy on national suicide prevention. And we want to work with Christine on a decade-long plan to help address this crisis, to deal with this crisis, and ultimately give every Australian a way back.